pn17. Q. The nurse is providing discharge teaching for the client with leukemia. The client should be told to avoid a. Using oil or cream-based soaps. B. Flossing between the teeth. C. The intake of salt. D. Using an electric razor. Rationale. The client who is immune suppressed and has bone marrow suppression should be taught not to floss his teeth. Answer A is incorrect because using oils and cream-based soaps is allowed. Answer C is incorrect because the client can eat salt. An electric razor is the best way to shave, so answer D is incorrect. Q. Which one of the following symptoms is common in the client with duodenal ulcers? A. Vomiting shortly after eating. B. Epigastric pain following meals. C. Frequent bouts of diarrhea. D. Presence of blood in the stools. Rationale. Melena, or blood in the stool, is common in the client with duodenal ulcers. Answers A and B are symptoms of gastric ulcers. Therefore, they are incorrect. Diarrhea is not a symptom of duodenal ulcers, therefore, answer C is incorrect. Q. The client arrives in the emergency room with a bullseye rash. Which question would be most appropriate for the nurse to ask the client? A. Have you found any ticks on your body? B. Have you had any nausea in the last 24 hours? C. Have you been outside the country in the last 6 months? D. Have you had any fever for the past few days? Rationale. The bullseye rash is indicative of Lyme's disease, a disease spread by ticks. The signs and symptoms include elevated temperature, headache, nausea, and the rash. Although answers B and D are important, the question asks which would be best. Answer C has no significance. Q. The nurse has given instructions on pursed lip breathing to a client with emphysema. Which statement by the client would indicate effective teaching? A. I should inhale through the mouth. B. I should tighten my abdominal muscles with inhalation. C. I should contract my abdominal muscles with exhalation. D. I should make inhalation twice as long as exhalation. Rationale. Contracting the abdominal muscles with each exhalation is the proper technique for pursed lip breathing. Answers A, B, and D are all incorrect techniques. The goal is to increase the exhalation phase. Q. A 3-year-old is diagnosed with diarrhea caused by an infection with salmonella. Which of the following most likely contributed to the child's illness? A. Brushing the family dog. B. Playing with a pet turtle. C. Taking a pony ride. D. Feeding the family cat. Rationale. Salmonella infection is commonly associated with turtles. Answers A, C, and D are incorrect because they are not sources of salmonella infection. Q. A client with a bowel resection and anastomosis returns to his room with an NG tube attached to intermittent suction. Which of the following observations indicates that the nasogastric suction is working properly? A. The client's abdomen is soft. B. The client is able to swallow. C. The client has active bowel sounds. D. The client's abdominal dressing is dry and intact. Rationale. Nasogastric suction decompresses the stomach and leaves the abdomen soft and non-distended. Answer B is incorrect because it does not relate to the effectiveness of the Ying suction. Answer C is incorrect because it relates to peristalsis, not the effectiveness of the Ying suction. Answer D is incorrect because it relates to wound healing, not the effectiveness of the Ying suction. Q. Which area in dark-skinned individuals would be the most likely to show a skin cancerous lesion? A. Chest. B. Arms. C. Face. D. Palms. Rationale. The palms of the hands and soles of the feet are areas in dark-skinned clients where skin cancer is more likely to develop because of the decreased pigmentation found in these areas. Answers A, B, and C are areas where high pigmentation occurs and, therefore, are less likely to show signs of cancer. Q. A client is 2 days post-operative colon resection. After a coughing episode, the client's wound eviscerates. Which nursing action is most appropriate? A. Reinsert the protruding organ and cover with 4x4s. B. See over the wound with a sterile 4x4 and ab dressing. C. Cover the wound with a sterile saline, soap dressing. D. Apply an abdominal binder and manual pressure to the wound. Rationale: if the client eviscerates, the abdominal content should be covered with a sterile saline, soap dressing. Reinserting the content should not be the action and will require that the client return to surgery, thus, answer A is incorrect. Answers B and D are incorrect because they are not appropriate to this case. Q. An elderly client with anemia has a positive Schilling test. The nurse knows that the client's anemia is due to a chronically low iron store. B. Abnormal shape of the red blood cells. C. Lack of intrinsic factor. D. Shortened lifespan of the red blood cells. Rationale: A positive Schilling test indicates that the client has pernicious anemia, which is due to the lack of intrinsic factor. Answer A describes iron deficiency anemia, therefore, it is incorrect. Answer B describes sickle cell anemia, therefore, it is incorrect. Answer D describes Cooley's anemia, therefore, it is incorrect. Q. A client with sickle cell disease is admitted with pneumonia. Which nursing intervention would be most helpful to prevent a sickling crisis? Obtaining blood pressures every 2 hours. B. Administering pain medication every 3 to 4 hours as ordered. C. Assessing breath sounds once a shift. D. Monitoring for fluids at ordered rate of 200 megaliters HR. Rationale: hydration is needed to prevent slowing of blood flow and occlusion. It is important to perform assessments in answers A, B, and C, but answer D is the best intervention for preventing the crisis.